So Diagnostic Robotics is a clinical triage company that has been working with 75% of the HMOs in Israel and dozens of millions of people in the United States, building flows using artificial intelligence to help reduce ED waiting time for specialists and help navigate patients to correct locations. But a few months ago, everything changed with COVID. We've been asked by the Israeli Minister of Health to extend our clinical triage system to monitor and assess 8 million patients daily in Israel. Since then, we've been working with all of the HMOs, Israel 911, and all of the hospitals. What we've been providing the Israel Minister of Health is an epidemiological map showing them where COVID is right now, but most importantly, using machine learning algorithms predicting how it's going to spread. We're doing this using open source information, such as foot traffic information, but additionally, we also connect symptomatic load information from patients. In other words, every person in Israel on a weekly basis is receiving a text message from their medical provider being asked clinical triage questions. All of this is anonymous. At the end, the patient is receiving their risk level and instructions about where to go. And all of this information is being used to create heat maps and predictions about COVID wave. Most recently, we've also started building non-anonymous systems. In other words, if the machine learning algorithm predicts, based on the symptoms of the patient, that they have a high probability of COVID, a red flag will be sent to their medical provider and trigger a care management flow. So summarizing the process, either I'm a worried well patient, which I'm trying to call 911, and while waiting, I'm filling in a clinical triage questionnaire, or I'm being monitored by my provider. We all fill in the same questionnaire. If the patient has no COVID, they get an all-clear recommendation, but if they do, they're being urged to contact a call center. And if not anonymous, their provider will also be notified. But the core of the system is this epidemiological map that helping the Minister of Health around quarantine decisions, identifying the second wave, and resource allocations. We've seen that it increased significantly the adherence to public health guidelines from the population. And for the health system, it reduced by almost 30% the loads on call centers while protecting the safety of the healthcare personnel. But the main benefit is the control of the pandemic by the governmental agencies. They've been able to identify which cities need to quarantine, how to go out during exit strategy before a second wave hits us, and resource allocations, where to send the COVID tests, where going to be problems at different hospitals, etc. In Israel, 25% of the population fills in the questionnaire at least once a week. 83% of responders finish the questionnaire from beginning to end. And this is the actual reporting that the Minister of Health receives. Each point here is a city. This is how many COVID patients have done a positive COVID test. In orange, you see the actual numbers the Minister of Health had. And in green, this is the predictions of the system of the symptomatic load in this location based on the triage questions. This city is one of the first cities that went into quarantine in Israel. This city is an interesting story. The Minister of Health has not been doing COVID tests, but a lot of people were doing them privately and reporting. The system also verified them using the clinical triage, alerted about the system, though the ministry had almost no information about the city. On April 4th, we were allowed once to publish our predictions publicly. We selected 3 cities based on the symptomatic load: Migdal Emek, Tiberia, and Ashkelon. The Minister of Health has sent COVID tests to those locations and indeed verified our predictions, and those cities went into a breathing closure to stop the pandemic. This is a story of 2 cities. In both of them, this is the symptomatic load. We alerted around this location when it started rising. Here, the intervention was low, and the graph continued growing exponentially. In this case, we've seen that the intervention was very high. Many COVID tests were sent, and the National Guard has almost flattened the curve of the symptomatic load. The system also identified us a way of learning this pandemic very early on. Approximately 2 months and a half ago, before academic publications, we already identified that loss of sense and smell is one of the main correlating features for this disease, while at that time, fever was considered one of the main symptoms. Another less well-known correlating feature is extreme fatigue, which we've identified for this disease. Behind the scene, the machine learning algorithms are learning different correlations of those symptoms to identify high probability for COVID. So for example, dry cough with extreme fatigue is much more correlative with fever. This enabled us to change completely the guidelines for COVID tests in Israel. The reporting has been given to the Vice President of the Ministry of Health on a daily basis, making all of the decisions around COVID tests. We've deployed a system with our partners in Deloitte in Odisha state in India, and also we deployed it in Rhode Island. The system supports multiple languages, just examples, English, Spanish, Portuguese, Oriya, Mandarin, Arabic, Russian, Hebrew, etc. The system can be up and running in a single day and completely customizable. And I think this is a good forum to also call. We're donating this system, only asking to cover our cost, so we can actually help with the knowledge that we obtain here from running the system in 3 countries and donate it to other countries still fighting during COVID wave and before the second wave. Thank you.
Excellent. Thank you very much. Thank you for your very precise, informative, and timely presentation.